Emotional abuse, also called psychological abuse, is a pattern of behaviors that belittle, control, isolate, manipulate, or otherwise harm a person's sense of self without leaving visible physical marks. It can happen in intimate relationships, families, schools, workplaces, and care settings. Because it often works by wearing someone down slowly, insults, gaslighting, chronic criticism, threats, withholding affection, it is both common and easily overlooked. Signs to watch for include persistent belittling or name-calling, repeated threats or intimidation, chronic blaming and shaming, controlling who the person sees or what they do, isolating them from friends and family, repeated humiliation or public embarrassment, gaslighting, denying or rewriting events so the victim doubts their memory reality, and silent punishment or stonewalling. Victims may appear anxious, withdrawn, hypervigilant, chronically apologetic, or display sudden drops in self-esteem and confidence. Outside observers sometimes spot the pattern before the person inside the relationship does. Emotional abuse can be subtle and accumulative. Tactics that seem small, taken one at a time, sarcasm used as jokes, repeated undermining of decisions, or frequent tests of loyalty, build over time into a pattern that erodes a person's autonomy and sense of self. Because perpetrators often alternate cruelty with affection, victims can become stuck hoping for the relationship to revert to its better moments. Recognizing the pattern, not individual incidents, is essential. The mental health consequences are substantial. Large syntheses and meta-analyses find emotional abuse is strongly associated with depression, anxiety, PTSD symptoms, and later psychopathology, often showing equal or greater associations with poor mental health outcomes than physical or sexual abuse alone. Emotional abuse also predicts interpersonal difficulties, substance problems, and increased suicide risk in some studies. These links are robust across many populations. 3 large influential studies that help show the scope and lasting impact of emotional, psychological abuse are worth calling out explicitly. The Adverse Childhood Experiences, AC, study, Felitti et al., a population-based investigation of over 17,000 adults, showed strong, dose-dependent links between childhood emotional neglect, abuse, and many adult health problems, mental and physical. A 2019 multi-sample study comparing emotional, physical, and sexual abuse found those reporting emotional abuse had higher scores on depression, anxiety, stress, and related traits, highlighting emotional abuse's unique predictive power for later distress. A 20-year longitudinal cohort analysis that followed thousands of families from pregnancy into adulthood found emotional abuse and neglect carried wide-ranging negative outcomes: school problems, mental illness, substance use, and psychosis, sometimes showing larger long-term effects than physical or sexual abuse. Because emotional abuse injures thinking, attachment, and safety systems rather than just the body, counseling for survivors emphasizes both safety and repair of meaning and self-belief. Evidence-informed approaches commonly used include trauma-informed therapy, cognitive behavioral therapy, CBT, or trauma-focused CBT, to identify and reframe maladaptive beliefs, dialectical behavior therapy, DBT, skills for emotional regulation and interpersonal effectiveness, acceptance and commitment therapy, ACT, for values-based living, and EMDR for trauma-linked symptoms in some clients. Online and remote interventions have also gained evidence, increasing access for survivors who can't meet in person. What the research says about what works. Systematic reviews point to promising but still developing evidence for trauma-informed, multimodal interventions specifically tailored to emotional psychological abuse survivors. Many trials focus on mixed trauma samples, but meta-analytic findings suggest trauma-focused CBT and structured, skills-based therapies reduce depression, anxiety, and PTSD symptoms. EMDR has demonstrated effectiveness in trauma-related symptoms in randomized trials, and programs that include safety planning, psychoeducation, and social support building tend to produce better outcomes. That said, the literature still calls for more trials that isolate emotional abuse-specific interventions. In practical counseling terms, early sessions usually focus on safety. Is the client still in a coercive or dangerous relationship? Stabilization, sleep, grounding, reducing crisis symptoms, and psychoeducation, naming emotional abuse, normalizing reactions. Middle phase work often uses CBT, DBT, ACT techniques to challenge internalized shame, rebuild assertiveness and boundary skills, and process traumatic memories safely. Later work may focus on rebuilding relationships, vocational or social reintegration, and relapse prevention, often with referrals to legal, housing, or medical supports if needed. Therapists who adopt trauma-informed and culturally sensitive stances, validating the client's experience while avoiding re-victimization, get better engagement and outcomes. Couples work can be appropriate only when abuse is no longer ongoing and both partners engage voluntarily and safely. Otherwise, couples therapy risks re-exposing the survivor. Where intimate partner emotional abuse has occurred, clinicians often recommend individual trauma-informed work first, safety planning, and where appropriate, legal or social supports. Child emotional abuse requires safeguarding protocols, mandatory reporting where applicable, and interventions that include caregivers and schools alongside individual therapy for the child. Finding help. Look for licensed professionals with trauma or intimate partner violence experience, clinical psychologists, LCSWs, LPCs, and ask about their training in trauma-focused CBT, EMDR, DBT, or family therapy. If immediate danger exists, contact emergency services or local domestic violence hotlines. Many national and local organizations maintain searchable therapist directories and crisis lines. Hospitals and child protection services can also connect survivors to multidisciplinary care. Teletherapy and validated online programs can be a practical route when local options are limited. Finally, healing from emotional abuse is possible, but often non-linear. Counseling aims to restore safety, reduce symptoms, reframe internalized blaming, and rebuild trust and agency. Because emotional abuse attacks a person's identity and relationships, recovery commonly benefits from sustained, evidence-based therapy, plus strong social supports. If you or someone you care about is experiencing these signs, reaching out to a trusted health professional or an advocacy hotline is a crucial first step. Contact TCA Counseling Group for virtual or in-person counseling if you live in Massachusetts.